thank all of you for coming. What a turnout. I take this as an honor to be able to speak to all of you tonight, and hopefully I can get you some good information. Before we're going to get going, we have a little bit of a presentation about some upcoming events that, in light of this talk, may be very helpful for you if you want to attend. So Megan and our awesome dietitian, June Denning, are going to come up and just say a couple words here.
Okay, for starters, they made me wear this shirt. Okay, well, good evening. My name is Megan Moskowitz, and I'm the director of the Community Education Program at the Lake Tahoe Community College. And so we are here because we are 100% behind what we're going to hear tonight from Dr. Young. And we have taken it one step farther. So we actually have some really great resources for you to jump into, because you're going to be so excited after we get to hear all that Dr. Young has to say.
Maybe.
How's that? So I work with a team of really amazing, visionary entrepreneurs, and so if I can have the teaching team for the events that we're doing at the college stand up really quickly. We have Yvonne and Jean and Michelle and June. And so not only are they the leaders in these resources that I'm going to share with you, but they also provided all the snacks for you tonight. So everything that you're eating is whole food, plant-based, no oil. And you can have all of these recipes if you want to come to one of our cooking classes that June's going to share with you.
So quarterly, we're offering whole food, plant-based, no oil cooking classes. And it's been a really pretty cool venture. As a dietitian, I've worked with lots of people and teaching academic nutrition at the college, and people would say, well, okay, I'm convinced, but how do I do it? And having the facility, the beautiful facility at the college, and then having these wonderful people as resources, we actually bring people in the kitchen and they cook and try to make it a really fun, very organized, and experiential day.
Great. So we have one of these classes upcoming. Who's been to one of the plant-based cooking classes? Raise your hand.
Oh,
That's great.
It's all the
So
plant
our next
people.
class happens to be coming up in April, and these do sell out every single quarter, so that's a really great opportunity. And then two other really quick things I'm going to note. We are, and these flyers are on the table when you walk out, but we're showing the movie Game Changers. Who's seen it? Okay, so we're showing the movie at the Duke Theater at the college on March 6th, and we are going to be promoting, so we're taking the plant-based cooking class that June spoke about, and we're creating a 3-day institute around it. So it's going to be the cooking classes along with movement classes, meditation. It's just this whole big package, and we're going to host it here in Lake Tahoe at the college. So this institute is coming up at the end of August. It's a 3-day institute where we have some really wonderful partners in town. Barton is heavily involved. Dr. Bergner is speaking, and we have 2 other Barton employees that are going to be there. So anyway, we just wanted to share that there are resources out there. You're going to hear some great stuff, and you can just jump on in.
Thank you. All right, thank you guys. Can everyone hear me okay? Everywhere in the room, everyone can hear? No gaps? All right, perfect. Well, I again want to thank you all for coming. I chose this topic because this has really been a learning process for me as well. In medical school, we're taught very thoroughly how to treat heart disease with medications and therapeutics, but we're not given a lot of information on diet and lifestyle. And I've started to see with the advent of the CHIP program, more and more of my cardiac patients coming back to me with just huge improvements. Blood sugar reductions, weight loss, cholesterol improvements, to the fact that I was peeling back medications. And their outcomes were so much better than their peers who continued to follow the traditional Western diet that it started my brain thinking of there's got to be something to this. And I think it's, we live in a country of fad diets. Everyone wants a fad diet, but I think there is a lot to this, and I'm sort of excited to share some of this with you. I will also tell you in my research for this that this is a very controversial subject. People are very opinionated about diet. And when you just type in something like diet or best diet for cholesterol into Google, you get a million different answers. So I don't want to tell you that I know everything. There are certainly mega plant experts in here. I call them the plant people that know a lot more than me. But I will try and best to give you guys some objective information and how I approach things. So what is cholesterol? Cholesterol is derived from the Greek word chole, from bile, and stereos, which means solid, because the cholesterol molecule itself was originally discovered in gallstones. It's an organic molecule called a sterol, which is a type of lipid, and every animal cell has cholesterol. You have to have cholesterol to survive because cholesterol has important purposes in your body. It helps maintain the integrity of what's called the cell membrane, or the outer lining of cells. It helps with signaling across cells and can also be a bioprecursor for a lot of hormones and even vitamin D. So everyone requires some degree of cholesterol. The problem is too much cholesterol is bad. And we've known this since the 1950s. So they developed what was called the Framingham Study. And the Framingham Study was in the small town of Framingham, Massachusetts, where they took detailed medical records on the population. They'd measure their blood cholesterol, their blood sugars, their blood pressures, and they'd longitudinally follow them over time. And what they found is that starting at a value of a total cholesterol of around 185, as your cholesterol increases, your risk of cardiovascular disease almost begins to grow exponentially. No one will argue that higher levels of LDL translate into increased cardiovascular risk. And this same Framingham study is where we developed the data for all the other risk factors such as diabetes, tobacco abuse, and so forth. So how do we check your cholesterol? Well, the good news is it's pretty easy. It's just a fasting blood test that you can have performed as either part of your Barton wellness profile, we'll show it, go into your primary care. Any physician can order you a fasting lipid profile. Now, the reason we want you to fast for this is after you eat food that contains cholesterol, it does elevate your serum levels for about 7 to 10 hours. So we want to make sure that you are fasting for at least that long so we can get your cholesterol down to a baseline value. Currently, the American Heart Association wants you to start checking your cholesterol when you're 20 years old to do early screening. And since most people don't have significant cholesterol abnormalities at that stage, every 4 to 6 years is appropriate. By the time you hit 40, we start to check it more frequently, even almost on an annual basis, because we use that data from your cholesterol profile to calculate what we call your 10-year risk of a heart attack or stroke or cardiovascular death. And any one of you guys can do that. It's really easy. If you just type in the cvriskcalculator.com into Google, it'll take you to the web page, and you just need to put in your age, your blood pressure, your last cholesterol numbers, whether you're a smoker or diabetic, and it will tell you your risk over the next 10 years of having a heart attack, stroke, or death from cardiovascular cause. So what are the cholesterols that you get? Well, you get these numbers back, and there are several different types of cholesterol or fats that we look at. The first are what are called triglycerides. So this is the primary storage facility for fat in your body. So if you're eating more fat or what we call high glycemic index carbohydrates than you're burning, your body stores them as triglycerides. They're like a storage fuel. So we measure your triglycerides. We also measure what's called your HDL. Now this is your good cholesterol. This is the one that you want high because this one circulates around in your blood vessels. It picks up the bad cholesterol, takes it to your liver where it can be excreted. And then we also measure your LDL. This is the bad one. This is the one that is associated with plaque formation in your arteries, a process that we'll show later called atherosclerosis. There's also several other types of cholesterol that are more difficult to measure. So there's other particles other than these, and we don't routinely report them on a fasting lipid profile, although you can have more advanced lipid testing, which will depict those. So they kind of get lumped into what's called your non-HDL cholesterol. And really you can think of that as your total cholesterol in your body minus the good. So it's sort of the sum of all the bad cholesterol in your bloodstream. So what are good cholesterol levels? Well, here's what your optimal levels should be. You want your total cholesterol less than 200. Okay? Again, having a total cholesterol of less than 150 conveys an extremely low risk of developing cardiovascular disease. Your LDL or your non-HDL cholesterol, the sum of the bad cholesterol, you want less than 130. Your LDL, the bad cholesterol, ideally you want as low as possible, but ideally you would like that to be less than 100. And your HDL, your good cholesterol, you want as high as possible, ideally over 40 for men. Women tend to have a higher HDL cholesterol than men, so we like to see that at least 50, hopefully at 60. So sometimes your LDL that you get on your blood test doesn't tell the whole picture. And there's more and more research going into more detailed breakdown of what we call your lipoprotein analysis. And what people are wondering is, well, maybe not all LDL cholesterol is the same. And sometimes people can have really small, dense LDL particles, and sometimes people's LDL particles are really big. And we call them small dense, which is pattern B, and there's large buoyant, which is pattern A. So although the concentration may be the same, that doesn't always equate because you got way more cholesterol particles here that are small and dense than the large buoyant particles. And what people think is that these small, dense LDL particles are more apt to be absorbed into your blood vessel wall and lead to complications such as heart attack, stroke, and peripheral vascular disease down the road. I want you guys to remember that, the small, dense, and large buoyant, because that's going to come up a few more times. So where do you get cholesterol? Well, about 85% of the cholesterol in your body is made in your liver. In fact, your liver can make all the cholesterol you ever would need. And about 15% of it comes from what you take in dietary sources. Well, what do you eat that raises your cholesterol? Well, again, this gets debatable, but overwhelmingly, trans fats are horrible. There should be no reason to consume trans fats. Trans fats do occur biologically, but most of the time they're made in a factory. And they add hydrogen to vegetable oils to make them more solid and easy to transport. Trans fats are used in fryers, they're used in a lot of baking goods, and restaurants and fast food places love them because you can pack it in the fryer and you can fry over and over and over again in it, and the frying oil doesn't get bad. Trans fats have been documented to increase your cholesterol, increase your risk of heart disease, and there is no society out there that advocates intake of trans fats. The next fat is saturated fat. Now they call them saturated fat because it refers to the molecular structure of the fat. So fats are like long chains of carbon atoms. And these carbon atoms, when they're saturated, are all attached to a hydrogen, and I'll show you that in a few minutes. These are the animal fats that are solids at room temperature. Now that's not always the case, but for generalized speaking, these are the solid fats at room temperature, of which butter is a classic example of a saturated fat. So when you flip over the nutrition label on all these foods, not only will it tell you the total fat content per serving, but it will also tell you the degree of saturated fat. So here are some examples. So here's the molecular structure of saturated fat. So here is the long carbon chain, and this is sort of they call them fatty acids. This is the acid group at the end. And you can see that every carbon here is attached to a hydrogen. So they're saturated and they stack right on top of each other, which helps them attain that solid structure. That's opposed to the good fats, which are the unsaturated fats. So here is an example of a monounsaturated fatty acid. So you can see that in this case, the carbons are hooked up and there's no hydrogen. And then polyunsaturated fatty acids, the even better fats, have more of these carbons hooked up together than saturated fats just with hydrogen. Just so in your brain you can kind of keep track of why these fats are different. So what foods are high in saturated fat? If they're high and they may lead to increased cholesterol, what do you need to avoid? And to make this simple to people in the office, I tell them it's the hoofed animal problem. So they all come from hoofed animals. They come from animal fats. Plants don't have saturated fats. And for the most part, plants don't have cholesterol. Saturated fats come from animal protein products. So beef, lamb, pork, poultry with the skin on, beef fat, creams, butter, cheese, and dairy products. Those are your main sources of saturated fat that you intake in a Western diet. Now, to be conclusive, some of the plant-based products can also have saturated fat as well. So palm oil, palm kernel oil, and coconut oil are also high saturated fat foods. Well, are saturated fats bad? And again, this depends which Google site you look at. Some say yes, some say no. The American Heart Association wants me to tell you that they're bad. And the reason that they think they're bad is because we know when you eat saturated fat, your cholesterol goes up, your LDL cholesterol goes up. And we know from the Framingham Study that the higher your LDL, the higher your risk of heart disease. So because of this, the American Heart Association wants you to get no more than 5 to 6% of your total calories from saturated fat, period. And with high saturated fat diets, they tell us that your risk of having a heart attack, stroke, or death can be 16 to 24% higher when you consume these products. Another interesting thing is they said, okay, well, if there's good fats and bad fats, what if I substitute the good fats for the bad fats? And by doing this, incorporation of the fish oils and the nuts and the avocados, all the good fats you hear about, you can decrease your risk of heart disease by 30% as opposed to continuing to consume saturated fats. But there's always a counter argument. Everyone's always got a different opinion. And some people think that this whole hypothesis is wrong. They just don't believe it. And this is sort of this diet heart hypothesis. And they believe, well, and so the theory is saturated fats raise cholesterol, cholesterol causes heart disease, so therefore saturated fats must cause heart disease. It's sort of the A equals B, B equals C, so A must equal C. And they just don't believe it. They don't think that there's enough scientific evidence to support this association because dietary studies are hard. I mean, a lot of them are observational. These aren't randomized, multi-center, placebo, double-blinded studies. This is a lot of observation, and there's bias in it. So there's a big group of people that just don't believe this. They may say, well, yes, maybe saturated fat increases your cholesterol, but it also increases your good cholesterol too, and that offsets the increase in your bad cholesterol. They also believe that, yeah, you eat saturated fats, maybe your cholesterol goes up, but maybe the majority of these fats are the large buoyant ones, the ones that are not associated with the increase in absorption into the artery wall. I will tell you that the majority, if not all, of the cardiovascular societies do not recommend eating saturated fat. And in fact, more and more are leaning to and advocating a whole food plant-based diet to reduce your risk of heart disease. But I just wanted you guys to know when you read this, there's other opinions out there. So what about cholesterol? We talked about trans fats, which are a no-no. We've talked about saturated fats, which should increase your cholesterol and increase your risk of heart disease. What about cholesterol-rich foods? So there's some foods like shrimp. Shrimp have a lot of cholesterol, but they don't have a lot of fat in them. Is that bad for you? And it turns out, unless you're really going overboard, it's hard to influence your blood cholesterol levels that much by eating cholesterol foods. It's much more driven by the saturated fat that you intake. And the reason is your body really tightly regulates cholesterol values. So you have that balance between what you're eating and what you're synthesizing. And if you intake more, you produce less. And so it kind of keeps it in harmony. Now, there's some people that are what we call hyperabsorbers. So some people just absorb cholesterol extremely efficiently from their GI tract and can be more prone to increasing their levels as they eat cholesterol-rich foods. Now, that's genetics, okay? There's nothing you can do to influence that. But it seems that even though these hyper-responders increase their cholesterol, it doesn't convey to the same increased cardiovascular risk as high consumption of saturated fats and trans fats. But what about the egg? It seems like everyone comes in and says, can I eat eggs? And I don't know. I mean, you look one day and says eggs are good, the next day eggs are bad, then eggs are good. It's kind of confusing, whether I can recommend people eat eggs. And it's hard because eggs for a lot of the world are a very good dietary source of protein, and there are other nutritional benefits of eggs as well, but they have a lot of cholesterol. But it's like a shrimp. They have cholesterol, but they don't contain a lot of saturated fat. In fact, some people think that when you eat eggs, it may help your cholesterol a bit and boost up your good cholesterol and drop down your bad cholesterol. So the best I can say to you is everything I looked at, of course, the plant people probably can't listen to this, but maybe 1 egg a day is okay, all right? An average of 1 egg a day seems to be safe, but I wouldn't cross that threshold more than that. So I guess on Sunday, if you're hungry, you have a 7-egg omelet and call it good. But there's one caveat to that. In people who have diabetes, for some reason, who eat eggs, there is an increased risk of heart disease in that population. So if you do have diabetes, I'd be a little cautious of the egg is safe hypothesis. So why do we get so worked up about this? Why are we so concerned about measuring your cholesterol and starting screening early and decreasing your saturated fats and increasing your trans fats? Is because this is what happens when you get cholesterol in your bloodstream. Is it begins to develop in your teens and 20s. In fact, when people came back from the Korean War and they started doing autopsies on hearts, and like 77% of those young soldiers, they found evidence of this cholesterol plaque depositing in their arteries. So this process of atherosclerosis, which is this hardening and plaque buildup in your arteries, begins for many, many, many years before you develop any clinical consequences of it. So you start developing these foam cells, then it becomes a fatty streak, and then you eventually develop this cholesterol plaque that starts to encroach inside the lumen of the blood vessel. The concern then is plaque rupture. So over time, this cholesterol plaque becomes inflammatory. So cells go in there and they start digesting this cholesterol. And then you get free radical formation. And then the cholesterol becomes what we call oxidized. And this inflammatory process starts to erode this, what we call fibrous cap over your cholesterol. And then when that cap ruptures, all of this cholesterol plaque spills out into your bloodstream. And you have little circulating cells called platelets in your bloodstream. So if you cut yourself, those platelets stick to the vessel wall to prevent you from bleeding. What happens is these platelets start sticking to all of this cholesterol material that spills into your bloodstream, and it occludes the blood vessel. So when you occlude a blood vessel, you have problems. If it's a blood vessel going to your brain, you have a stroke. If it's a blood vessel to your heart, you have a heart attack. To your kidneys, you have what they call a renal infarction or a heart attack of your kidneys. If it's to your legs, you develop peripheral vascular disease. So that doesn't sound good, and I don't think anyone ever wants to have that. So how do you decrease your cholesterol? Well, there are multiple ways, right? And just since this is a diet-focused lecture, I thought I'd just mention that exercise is a great way to lower your cholesterol. When you do exercise, you increase your HDL, your good cholesterol, and you decrease your LDL, your bad cholesterol. Some people also believe that the particles get bigger as you exercise. You increase your LDL particle size to be the big buoyant ones. As far as exercise, the more vigorous, the better, okay? So at least 30 minutes a day of a vigorous activity such as jogging, walking, biking. But the harder you exercise, the more you do, the better effect you get on your cholesterol. Of course, there's diet, when we're gonna get into here in a minute. And the next is medications, which is a whole nother polarizing issue. As soon as I bring up statins, I get mutiny in the crowd. So we'll stay out of that tonight. So I mentioned that we're a country of fad diets, and no one ever comes to me and says, well, I just want a balanced whole food diet that'll help reduce my cholesterol. It never comes up. Everyone comes to me and they're in like two camps. They're in, I want plants, or I want low carb, protein, high fat diet, because that's what I believe. And probably the classic example of this is the keto diet. It seems to be, and whether you're talking about Atkins, paleo, South Beach, they all sort of fall into that same category. So what is a keto diet? A keto diet is basically where you restrict your carbohydrate intake, so usually less than 10% of your daily calories from carbs. You keep your protein concentration moderate, but you dramatically increase the fat in your diet. And this diet was originally developed for epilepsy, for refractory childhood epilepsy. I think there's a movie like Lorenzo's Oil that's about this. but it's been adapted because it has weight loss properties associated with it. But what is the theory behind it? Well, the brain runs on sugar, right? So when you eat a carbohydrate, it's turned into glucose, and that fuels the brain. So what they do in the keto diet is they switch that. So if you cut off the carbs, then the body starts to rely on fat as fuel. So it breaks down your fat sources, those triglycerides. It sends them to your liver where they're turned into ketones. They're called ketone bodies. And your brain runs on those ketone bodies. So instead of glucose, you're now trying to run your body on fat. And that's why they call it ketosis, right? So you can measure the ketone concentration in your body to make sure you're in this ketosis or fat burning state. So why do people believe this? Well, again, they think the recommendations are wrong. They think that, was it Ansel Keys that came up with this whole dietary pyramid was wrong, there was bad science, and they think that the reason everyone's overweight, has all this cardiovascular disease, is we told them to cut out the fat and start putting in all these carbs. And since people are eating all these carbs, they're gaining weight, they're having high levels of insulin in their body, that insulin's leading to obesity, they're getting inflammation in their blood vessels, which is promoting vascular disease. And they think that all this insulin is making the cholesterol go small and dense as opposed to large and buoyant. That is their theory of this diet. Well, I'll tell you one thing about the keto diet is it makes you lose weight. And I don't think anyone would argue against that it can be a very effective weight loss utility because you're burning fats. And the fat loss can be really rapid. In fact, people can lose 10 to 15% of their body weight really quickly. But no one really knows, is that just water weight you're losing or not initially? The problem I've seen, at least in my patients who have tried this, is it's really hard to maintain. And they may lose effective weight, but to stay in this state of ketosis is difficult, and they usually rebound and put, if not the same, but more weight back on after they're done. But the weight loss has some benefits, right? You lose the weight, you decrease your what we call insulin resistance, so your body has less of this insulin floating around. It reduces the inflammation in the body, and we measure this with something called a high sensitivity CRP. If you guys have ever had a blood test, your primary's ordered, it's an inflammatory marker that will go down, and it does increase LDL particle size a bit, and it decreases your A1C, which is sort of a measure of your blood sugar. So some people think if you are at low cardiovascular risk, but maybe you're overweight, and your doctor's saying, hey, you're looking at type 2 diabetes here, that using this diet for a short-term rapid weight loss may be beneficial. The problem is it's really hard. There's a lot of side effects of the ketosis too. You get bad breath, constipation, diarrhea, muscle cramps, headaches. There's vitamin deficiencies. Some people get kidney stones. And again, it's really difficult to sustain this, and most people really have a hard time with it. Where I get concerned when people do this is it skyrockets your cholesterol. The published data here is 15 to 44% increase in your LDL cholesterol. And I think that depends on a lot of ways people get fats. If people are incorporating good fats, that's one thing. But a lot of times people, I talk to them and they'll be like, well, what'd you have for lunch? They're like, well, I had a triple stack hamburger, cheese, bacon, and a side of mayonnaise. And intuitively, it just sounds wrong. And every time I've seen someone do this, they've always come back to my office with a skyrocketing cholesterol and hypertensive from all the extra meats they're eating, invariably because they're incorporating more processed meats into their diet because they think it's safe. Well, I'm only eating fat, so it's good for me. So I would leave you with the fact that I don't think keto is good for your heart. I think it can help in certain small populations, whether it's a childhood epilepsy event or whether you're just trying to do rapid weight loss to help your blood sugar, but it's not sustainable. And at least in my experience with my cardiovascular patients, it has been harmful. In fact, I was talking to some of the other doctors outside, as we have a young patient who's 50 years old and he has a couple stents in one of his arteries. And he kept coming in and telling me, like, I think you're wrong. I don't believe this LDL cholesterol. I think that I want to do keto. I want off these meds. I don't believe your hypothesis. And I just told him, I said, I really think that's a bad idea. But people need to make their own decisions, and you can only advise them so much. And he just came back in last week after getting flown to St. Mary's for a second heart attack and 3 more stents. So it doesn't take too many of those to see and just think that's probably off mark for reducing your risk of heart disease. Switching 180 degrees, we're going to talk about plants. And it's funny, so we've been going through this process of thinking about cardiac rehabilitation at this hospital because it's an obvious void, and we were looking at these intensive cardiac rehab programs, and one of them is by a famous cardiologist called Dean Ornish. I don't know, you probably have heard of him. And they come and they're talking to us and everything sounds great, and I'm in this meeting and they say, okay, well, if you want to take this program to your hospital, everyone in here has to follow 3 months of whole food, plant-based, no oil, and jaws dropped. And everyone's like, there's no way I can do this. So I understand when you mention plants and you mention the word vegan, there's like an automatic wall for a lot of people that folds up right away. And I just lower the shutters for a little bit, and here's what we have to say. So plant-based diets really encompass a bunch of diets, right? There's variations of this. So there's obviously vegetarian, which excludes the majority of animal products. There's vegan, which is total exclusion, and then there's whole food plant-based. Now, their two are pretty much the same. They're differentiated a little bit because a lot of time vegan implies that you're making those decisions for an animal rights issue as opposed to a whole food plant-based diet, which is more of a health issue. It's a minor discrimination. But some people bend it a little bit. There's a lacto-vegetarian where sometimes you want a little dairy in your diet. There can be lacto-ovo-vegetarian where you want some dairy and eggs. And then there's even a pesco-vegetarian which incorporates seafood. So why are plant-based diets so good? Well, you're transitioning. You're going away from all this fats and high caloric rich foods to eating these healthy, low energy density foods devoid of all that saturated fat. You eat more fiber, and the fiber helps prevent cholesterol absorption from your intestine. And your fats get better, so you're taking away the saturated fats and you're incorporating them with these polyunsaturated fats, the so-called good fats. Plus, there's all kinds of antioxidants in plants and foods. They have these things called polyphenols that I was reading about, these molecules in plants that are like antioxidants that circulate around and reduce the inflammation in your blood vessels. You have vitamins that can be antioxidants, such as C and E. And then you get all kinds of micronutrients in plants, magnesium and potassium, which are incredibly vital for maintaining good blood pressure and vascular health. Well, how do they reduce risk? Well, I don't know, for those of you that have gone on plant-based, you eat a plate full of beans and brown rice, you're full, all right? You're full, and you're not eating for a while, so it helps with weight loss. Plus, you're eating what they call low glycemic index carbohydrates. So for those of you that don't know, not all carbs are bad, right? Carbs get a bad rap, and the carbs are graded by what we call a glycemic index. So when you eat a carbohydrate, how fast it gets turned into blood sugar as it is absorbed. So for instance, if you drink a Coke, that's a high glycemic index carbohydrate because it floods your body with glucose. You get this huge insulin surge, which puts fat in your abdomen and causes inflammation in your blood vessel. Whereas a low glycemic index carbohydrate, like a quinoa, is digested more slowly and it releases the sugar into your bloodstream much slower, and you don't have that high insulin response. So you're eating better carbs. You also get better cholesterol, right? Anyone that's done plants knows that your cholesterol drops dramatically because you're not taking in all these bad foods anymore. There's all kinds of data too about blood pressure. So things like beets that have nitrates, they can help release nitric oxide in your blood vessels, which can help dilate them, improve your vascular health, decrease your blood pressure, decrease your inflammation. So when you do this, and I know this is a number and it's hard to say because so many people vary, but you can probably expect at least a 15 to 30% reduction in your cholesterol when you follow a whole food plant-based diet. And I've seen, some people dramatically drop, 100 points. You decrease your non-HDL cholesterol, so that's the sum of your bad cholesterols, that will drop as well. Some people will tell you, yeah, but it drops your good cholesterol. Well, yeah, all your cholesterol levels drop. And we worry about that sometimes because your good cholesterol is inversely related to your risk of heart disease. So having a low good cholesterol, higher risk of heart disease and vice versa. But even though you may drop a couple points in your good cholesterol, the dramatic drop in your non-HDL and your LDL, there's really no increased cardiovascular risk to that. Some plant-based foods that lower cholesterol the most, well, the high fiber grains, oats, beans, barleys, other foods high in the soluble fiber. Soy protein, nuts, wheat germ, wheat bran, almonds, Brussels sprouts, which my boys love, which I'm happy about. They contain this cool compound called phytosterols. So we mentioned polyphenols, the antioxidant. These are phytosterols, and they help prevent absorption of the bad cholesterol from your intestine. Now, this may be plant-based, but this is what we call junk vegan, okay? So you have to be really, really careful when you transition because, of course, there's a ton of money in this whole food plant-based diet. And people are marketing all kinds of projects and stamping whole food plant-based, vegan on there. But you have to be really careful about what you're putting in your body. So instead, I would almost propose to you that we follow a different food pyramid. So you guys are all familiar with the food pyramids and your percentage of food you're supposed to eat. But in this case, the majority of your pyramid, the base of your pyramid, is vegetables. And an easy way to remember is try and eat as many colors as possible. Like when you make a salad, you make a rainbow in your salad. Fruits, whole grains, the low glycemic index carbohydrates such as brown rice, barley, quinoa, whole grain pasta, leafy green vegetables, legumes, and when you consume your fats, you want them to be the good fats, the polyunsaturated fats, such as nuts, olives, avocados, etc. So even though a junk food can be vegan, make sure you're applying this type of whole foods into your diet. I tell people this, and I get stone-faced. Everyone says, there's no way, man, I'm not doing that. I love you, I like coming to see you, but this just isn't going to happen. And I think that's okay. I read a book, one of the Dean Ornish books that was called The Spectrum. And I found it really fascinating because there's a spectrum of dietary choices you can make. If you're coming to see me and you've had a quadruple bypass, or you have horrible family history of heart disease, or you say, I want to be the most protective as I can for my heart, then it's a whole food, plant-based, no oil diet. There's no questions asked. But sometimes people they can't do that. So I kind of like this plate model because it kind of makes you think differently about how you eat. When you normally cook dinner, you're like, okay, I'm going to have roast beef and then a side of mashed potatoes and carrots or whatever. And so your dinner is focused around your animal meat protein and the vegetables and everything are an accompaniment. And you need to flip that logic. Okay, so now the majority of your plate becomes vegetables and fruits. The other quarter becomes whole grains and a small amount of a healthy protein. So whether that's fish, boneless, skinless, chicken thighs, chicken breast, beans, whatever. But you're staying away from the red meat, you're staying away from the cheese, you're staying away from bacon, the cold cuts, and all the processed meats. So dramatically shrinking down your intake of the animal protein products. And this is pretty much in concert with what the American Heart Association says. So here's their official guidelines. Majority of your intake is fruits, vegetables, whole grains. They do incorporate a little dairy, which I think there's some controversy over. The proteins are the healthy proteins, and the intake of oils are these polyunsaturated and monounsaturated fats. So in conclusion, I'd say everyone should have your cholesterol checked. Because the bad thing about cholesterol is you're not going to have symptoms. You won't know if your cholesterol is high until you have a blood test performed. You can decrease your cholesterol by vigorous cardiovascular exercise, and I would encourage everyone to do that. Certainly, avoiding trans fats is a no-brainer. Limit your intake of saturated fats. The whole food plant-based diet appears to be the most cardioprotective. And why is this? Because it reduces your cholesterol and your bad cholesterol. It has a proven overall decreased risk in your cardiovascular risk and mortality from cardiovascular disease. In patients who have coronary heart disease, there's a famous doctor, I think he's at Cleveland Clinic, is that Esselstyn at Cleveland Clinic? And he's actually taken patients in study arms and has put one on just a whole food plant-based diet and the other on traditional medicine and the Western diet, and hand over time, the people on the whole food plant-based diet do better. Okay, so there's significant data emerging that if you have cardiovascular disease, following this diet can improve your long-term outcome. The holy grail, of course, is how to reverse heart disease. It'd be great if I could put a catheter in your artery and suck out all the plaque and make it look like you're 18 again, but that's just not possible at this time. But more and more people are starting to believe that if you do have heart disease and you follow this whole food plant-based diet, that it may lead to reversal over time. So here are some interesting resources. So of course you guys have access to the CHIP program here, for those of you who don't know, the whole food plant-based program here, which is awesome. It's a 9-week course where if you're totally overwhelmed by the idea of going plant-based, which a lot of people are, they walk you through it. They check your blood before and after. You meet with Dr. Bergner, who reviews everything. We have cooking classes with June. And I would encourage all of you who are interested in to touch base with them, because I think it's a really fantastic resource that we have here. There's a couple cool documentaries that sounds like a lot of people you've seen on Netflix. One is Forks Over Knives, which is really interesting, and the other is Game Changers. I watched both of them with the family. I thought they were really eye-opening. There's also a really great study called the China Study, which was done by Dr. Campbell and his son, which is a longitudinal study of rural China. Which you probably don't want to go to now, but a long time ago, they would study them because in China, they don't eat a lot of animal protein. Their animal protein and animal fat intake is really low, and they eat a lot of these vegetables and pretty much a whole food plant-based diet. And looking at the low incidence of cardiovascular disease there, and not only cardiovascular disease, but cancer risk and all-cause mortality. It's a really interesting book. It's a big book. It's big. For those of you, I can't read that. My ADD kicks in. So they have it on Audible, so you can get it on Audible too, which is a really easy way to listen. Huh? Snooze it. So I thought this one was funny. The Chick-fil-A? They always have the Chick-fil-A. It's like eat more chicken. So they're all lined up, and it says eat more veggies, and the cows are asking who's the new guy. So with that, I think I'll finish. Hopefully that gives you a little insight into the different diets and a little bit of a plug moving forward to the whole food plant-based diet. I will tell you personally, we tried it. My family and I tried it. It's not as bad as you think. I mean, it's really, it's not. And it's such a hurdle in your brain to think, well, I can't have meat at dinner. What am I going to do? And it's really not as difficult as it sounds. So I'll stop there. And is there any questions? Hopefully I can answer. Yes, sir.